thing that I would like patients to know about me is that I enjoy what I do. I enjoy spending time with them. I enjoy seeing them through the process. I enjoy getting them through the procedure safely and back to what they enjoy. So most of the procedures that I perform are done arthroscopically or with minimally invasive methods. That involves surgery of the shoulder, knee, elbow, and specifically the hip. The hip is a specific interest of mine because we are able to use hip arthroscopy, which is a minimally invasive tool, to do a lot of complex procedures that even 10 to 15 years ago were done as an open procedure, where a lot of times the recovery period would be much more prolonged. But all of these procedures are done typically on an outpatient basis, with the exception of a few more complex reconstructions. So when patients come to see me, they can expect a comprehensive approach to their problem. That starts with the history and the physical exam in the office. It also means going over their x-rays, MRIs, or CTs if it is available. Once we've gotten to that point, it really is a discussion about what their expectations are for their ailment. At that point, typically we are looking to initiate physical therapy, conservative measures, and/or injections. These are all first-line treatments. For those that do not respond or that have not done well with it, then obviously the conversation can change to how we would fix that with surgical intervention. But at all means, we do try to treat them conservatively because we do feel that we are able to get back most patients with this type of approach. So I have a lot of academic interest outside the clinical practice that I have. One of the areas is in research. And so I do have a grant here from Scripps, and it is focused here on some of the basic research focused at hip stability, specifically for those that undergo hip arthroscopy. In addition, I am a reviewer for numerous sports medicine journals here. In terms of the articles that I've also published, it is something that I do feel is important in being able to push our field forward, and that comes from the academic pursuits that I have outside my clinical practice that are really focused in pursuing other research interests. The most satisfying and rewarding part of my job is spending time with patients after surgery and being able to coach them along the way. I think it's an important part of what we did when we signed up for this job. As an orthopedic surgeon, we are fixing problems that really, for the most part, have significantly impacted people's lives and lifestyles. And for that reason, being able to put that back together and help them get back to what they enjoy is without a doubt the biggest thing that I see as a rewarding aspect.